Hello everyone, welcome to today's lecture on training and support of primary healthcare workers. You can simply put it as the PHC workers. Now this is a subsection of the original course titled Primary Healthcare. It's important that we take note of that so that when we want to read wide, we can focus on the main subject. My name is Dr. Isagboyin Henry, and today we are going to unpack one of the most practical and foundational aspects of the PHC system, the people who make it work, fondly known as our health workers. You see, when we talk about health systems, we often focus on policies, funding, and infrastructure. It's important I give you this introduction. But without trained and supported health workers, none of those plans come alive. These health workers are the backbone of the PHC. They are the bridge between the health system and the community. According to the WHO, a strong PHC workforce is essential for achieving the universal health coverage. And not only the universal health coverage, it's also key in achieving the Sustainable Development Goals, that is the SDGs. Now, these great workers include the medical lab scientists, the pharmacists, the doctors, nurses, community health officers, midwives, and importantly, community health extension workers. I mean those who are closest to the people, the grassroots. So, in this lecture, we will explore how these workers are trained, what kind of support systems they need, and how continuous capacity building improves service delivery. We will also discuss how mentorship, supervision, and motivation can make or break a PHC system. And so I believe that by the end of this session, you will understand that investing in the PHC workers is not just about skill building. It's actually about sustaining community trust, improving the health outcomes, and also ensuring that no one is left behind. Let's now move into slide 2, the table of contents. Now, all right, before we dive deep into today's topic, let's quickly walk through what we'll be covering in this lecture. I always say knowing the roadmap helps you follow the learning journey better. And so once you understand this roadmap, then you understand what we're about to discuss, and even on your own, you can do a sort of, personal study alongside what I will be teaching you right now. The first one is Introduction to PHC workers. We will start by defining who primary healthcare workers really are, from the doctors and nurses to the community health officers and volunteers who keep the system running at the grassroots. Number 2, we'll look at the historical context and global frameworks. Here, we will take a short trip to back, what we would have learned in the introduction. And I mean a trip back in time to understand how the PHC started, especially after the Alma Ata Declaration of 1978. And we're going to look at global frameworks that have guided their training, and deployment. Number 3, we'll look at training of the PHC workers. Here we will discuss how PHC workers are trained, the curriculum they use, the competencies they must have, and why continuous training is key to quality health service delivery. Number 4, we will look at support mechanisms for PHC workers. After training, support is crucial. You don't just train and abandon them. We will therefore explore how supervision, mentorship, motivation, and community engagement helps PHC workers perform effectively. We would also see the challenges faced by the PHC workers. Of course, there are no perfect systems. We will identify some of the major challenges that these PHC workers face, from inadequate funding to burnout and even limited professional growth opportunities. We will then look at the impact and evaluation, where we will examine how effective the PHC workforce training and support systems translate into better health outcomes, using both the global and the Nigerian examples. Number 7, we'll look at the recommendations and policy directions. Here I will also share some practical recommendations and policy actions that can help strengthen PHC workforce systems at the national and local levels, and then we'll conclude the discussion. But before then, let's look at this pre-evaluation. But before then, I'd like to let you know that this pre-evaluation is not what should make you worry. So don't worry. It's not an exam. It's just to help you check what you already know about primary healthcare workers and the global initiatives, let me use that word, that have shaped their training and their support. That's all. So let's take the first question. It says, what is the primary focus of the CHIPS program in Nigeria? Do you know the answer? We will find out. You can also try your luck. You can attempt it and see whether you're correct. Question number 2, what was the critical goal of the Alma Ata Declaration in 1978? Is it A, is it B, C, or D? We'll find out as we go through this lecture. Question 3, which of the following is not a role of the PHC workers? Question 4, which global health initiative influenced the establishment of Village Health Workers Program? Number 5, what is a key feature of effective PHC worker training programs? Number 6, which challenge is categorized under operational challenges for the primary health care workers? Number 7, what significant outcome was achieved by India's ASHA program? And number 8, which country's program inspired rural community health care training in the 1950s? I'm sure you've attempted these 8 questions. Great job. Whether you got them all or just a few, we don't know yet, but this is a sort of warm-up. This warm-up sets the stage for what we will explore in this lecture. Now, let's move into the introduction to PHC workers, where we will define who they are, what they do, and why they are vital to achieving universal health coverage. You can see an example of diligent PHC workers within the community going about their duty. Now, if you look at this table of content, it further breaks down what will be seen in the major table of contents. So let's move in. Now we want to talk about the evolution of the PHC workers. We want to see the introduction. Who are the PHC workers? All right, everyone, let's take a moment to understand how primary health workers evolved here in Nigeria. This story is actually a reflection of Nigeria's long-standing commitment to strengthening healthcare delivery, especially for those living in rural and hard-to-reach communities. I'll start with the early days, that is post-independence period between 1960s to 1970s. After independence, Nigeria began to recognize the huge urban-rural gap in access to healthcare, and most doctors and nurses were concentrated in the cities, while rural communities had little or no access to basic care. So, the government started exploring ways to train local people who could serve as health aides, dispensary attendants, and community health workers. And the idea was simple: bring healthcare closer to the people. Number two, we have the Alma Ata Declaration of 1978. That was the global turning point. Then came 1978, a major global milestone known as the Alma Ata Declaration on Primary Health Care. The WHO and UNICEF declared that health for all could only be achieved through strong primary healthcare systems. And Nigeria, being a WHO member, adopted this principle and began integrating primary healthcare into its national health policy. Now, this decision laid the foundation for a formal kind of PHC worker training programs. And you will see this documented in the WHO 1978 document. The birth of the PHC system in Nigeria actually came up in the 1980s. In 1986, Nigeria launched the primary health care program under the leadership of Professor Olikoye Ransom Kuti. This era saw the training and deployment of community-based health personnel like community health aides, known as your CHA, community health extension workers, known as your CHUs, and environmental health officers. Now you see this category formed the backbone of the rural healthcare delivery. Number four, we had the expansion and integration. After it was formed, it began to expand and integration began to take place between 1990 to 2000. Over time, PHC became part of a larger strategy under the National Primary Healthcare Development Agency, which was established in 1992. Now, this agency helped organize training standards, supervision systems, and integration with immunization and disease control programs. The public healthcare workers were now not only providing first aid and immunizations, but they discovered that they are now also taking part in public health campaigns like polio eradication, family planning, and also malaria control. So you see, truly it expanded and it became integrated into the public health campaigns and other programs. Number five, let's see the modern era. The community-centered approach, which began between the 2010 to the very present day. In recent years, Nigeria has moved toward a community-driven model of primary care. A good example is the CHIPS program, that is the Community Health Influencers, Promoters, and Services, which was launched by the NPHCDA in 2018. Now, when I say NPHCDA, I mean the National Primary Healthcare Development Agency. So in 2018, they established the CHIPS program. Now, this program built on the successes of older community health worker programs and focuses on health promotion, early referral, and data reporting using a kind of simple digital tools that were made available at the time. Now you find that the National Primary Healthcare Development Agency began its function fully in that 2018, following the incorporation. In summary, when we look at the PHC workers, we talk about the evolution of this set of great workers in Nigeria. When we look at that, we are really talking about a journey, not just what started today. It has started for a long time, from simple community volunteers to a well-trained, system-recognized professionals. If you look at each phase, from post-independence to the community health influencers, promoters, and services, that is the CHIPS era, it shows that Nigeria was truly determined to bring healthcare closer to every household. So, at this juncture, we want to look at a bit of definition and just a bit of the early developments. I'll give you explanations. So let's take a moment to understand how Nigeria's primary healthcare workforce really evolved over time. You see, the story of PHC workers in Nigeria didn't just start recently, like I said. It has deep roots going back to the 1970s, when the country began to recognize that many people, especially in rural and underserved communities, were not getting access to basic care. So in 1975, the government launched what was called the Basic Health Services Scheme, BHSS, and this was a really important milestone. Now, the main goal was simple, but yet powerful. It was to make healthcare available and accessible to everyone, no matter where they lived. Therefore, to achieve this, the scheme emphasized training different categories of health workers, especially community health extension workers known as the CHUs and junior CHUs, like you have in the College of Nursing today or College of Health Tech today. These cadres were specifically designed to work at the grassroots level, providing preventive, promotive, and basic curative care. They were trained not just to treat illnesses, but to engage with the community, conduct health education, promote hygiene, and encourage immunization. And this moved, successfully well, up to the point that it reflected a shift in thinking from depending solely on doctors and nurses in urban hospitals to empowering community-based practitioners who could bring their healthcare or bring healthcare closer to the people. Now, as the system kept expanding, there was a growing need to standardize the training, the ethics, and the practice of these workers. And this led to the formal establishment of the Community Health Practitioners Registration Board of Nigeria, which is known as the CHP-ROBN, in short, Community Health Practitioners Registration Board of Nigeria. They regulate the program that give birth to the CHUs and the junior CHUs. Also, nursing from the College of Nursing and so on. Now, through Decree 61 of the 1992, which later became CAP C19, Laws of the Federation of Nigeria, 2004, we discovered that the CHP-ROBN was set up to regulate, to monitor, and accredit all community health training institutions, and to ensure that every practitioner meets professional standards before being licensed. In other words, it's professionalized community health practice in Nigeria. Therefore, ensuring that those serving in villages and PHC centers were not just any longer volunteers, but qualified, trained professionals. Therefore, in summary, the evolution of PHC workers in Nigeria started with a vision for universal access. It then grew through structural training initiatives and matured with regulatory oversight, all working together to make sure no Nigerian is left behind in healthcare delivery. Let's move to slide 9. Here we'll be looking at the training and the deployment of the primary health care workers. Now that we have seen how community health practice started in Nigeria, let's talk about how these workers are trained and deployed today. You see, one of the strengths of Nigeria's PHC system actually lies in its network of accredited training institutions. Across the country, we have several colleges and schools of health technology, along with university teaching hospitals that are officially accredited by the Community Health Practitioners Registration Board of Nigeria. Now, these institutions play a very strategic role. They don't just teach theory. They provide hands-on practical training to prepare students for real community health work. Now, through this system, the nation produces a range of trained cadres, and they include, number 1, the community health extension workers. Number 2, the junior community health extension workers. And number 3, community health officers. Now, each of these groups is trained with specific competencies and scope of practice, which is designed to meet the diverse health needs of both the rural and peri-urban populations. This is stated in the USAID document of 2017. For example, the junior CHUs typically work at the village or ward level, and they focus on health education, environmental sanitation, and disease prevention. While the CHUs, not the junior CHUs now, the CHUs provide a broader range of services, such as immunization, antenatal care, and treatment of minor ailments, often at primary health centers. Now you have the community health officers, on the other hand, are supervisory and leadership cadres who manage the PHC facilities and also oversee the work of the CHUs and the JCHUs. This layered structure ensures that each level of the community health workforce contributes meaningfully to achieving national health goals. Now, beyond training, you can see that deployment is another key aspect. The Nigerian PHC system emphasizes community-based posting, meaning that these workers are deployed back into their own or similar communities where they come from. And this helps to build trust. It enhances cultural understanding and improves health-seeking behavior among community members. Their roles and responsibilities go far beyond just treating illnesses. The PHC workers are expected to, number 1, I repeat, the PHC workers are expected to, number 1, provide basic healthcare services. Number 2, carry out health education and promotion. Number 3, support maternal and child health programs. Number 4, conduct disease prevention campaigns. And number 5, act as links between community and formal healthcare system. In fact, they are often the first point of contact for many Nigerians. And this makes them a cornerstone of the country's PHC strategy. Through their work, health outcomes such as immunization coverage, maternal survival, and community participation in health programs have all improved over the years. So when we think of PHC in Nigeria, we must remember it stands on the shoulders of these trained and committed community health practitioners who bridge the gap between policy and people, between hospitals and homes. So, I'd like us to move to slide 10. Here, we want to see challenges and prospects of the PHC workers in Nigeria. Let's see their challenges. This is very important. The real-life challenges and future prospects of primary healthcare workers in Nigeria. It's a must that we look at it because it's something very important. You see, while these health workers form the backbone of community health delivery, the reality is that they operate in very tough conditions. Let's start with the challenges. Number one, resource constraints. Resource constraints. Despite their critical role, PHC workers often have to do so much with very little. They face inadequate funding, shortages of basic medical supplies, and poor infrastructure in many health facilities. For example, many rural PHCs still struggle with inconsistent electricity, lack of clean water, or even essential drugs. Add to that limited supervision and low incentives, and you can imagine how these factors can reduce motivation and effectiveness. Sometimes a single CHU or JCHU might be responsible for hundreds of households. Don't forget, they are the very grassroots. And they are covering the immunization, antenatal care, health education, and disease surveillance, all at once. Carrying this out by the CHU and JCHU. So you can imagine the workload. Therefore, without the right support, they will certainly be exhausted. And you truly know that this can be exhausting. So, resource constraints is the first challenge. Number two, integration efforts and systemic prospects. Integration efforts and systemic prospects. Now, on the brighter side, Nigeria has made steady progress in trying to better integrate PHC workers into the national health system. Over the past 4 decades, there's been a growing focus on community-oriented health services that link the primary healthcare workers more directly to local governments and state ministries of health. This integration helps to strengthen supervision, improve data reporting, and also ensure that the PHC services are part of a coordinated national health framework. In fact, several programs like the National Primary Healthcare Development Agency, initiatives, and community health influencers, promoters, and services, which you know as the CHIPS program, are designed to enhance community engagement and also make PHC delivery more sustainable. In terms of the prospects, let's look at that. If Nigeria continues to invest in better training, proper remuneration, giving them logistic support, and clear career pathways for these primary healthcare workers, the future will certainly look very promising. These workers are already shown that with the right environment, they can dramatically improve community health outcomes. So, While challenges exist, this prospect remains strong. Despite these challenges, this mindset, this prospect for a better outcome is still there. And with stronger policies, showing with clear commitments and community ownership, these primary healthcare workers can truly drive the nation closer to universal health coverage. So, remember the challenges and the prospects. Number one, resource constraints. And then we have also seen, number two, integration efforts and systemic prospects. So, let's remember this. Very, very important. We'll move to slide 11, where we want to see the recent developments in PHC worker training and support. We'll be focusing on the CHIPS program. All right, so let's bring things closer to the present day now. In recent years, Nigeria has taken a major step forward in strengthening community health services through a program known as the CHIPS, and this stands for Community Health Influencers, Promoters, and Services. Now, what exactly is CHIPS? What exactly is CHIPS? Now, the CHIPS program was launched by the federal government of Nigeria under the coordination of the National Primary Health Care Development Agency. It was designed to bring together all the various community health initiatives like CHIUs, traditional birth attendants, and volunteer programs into one harmonized structure. Why was this necessary? Because before CHIPS, there were multiple community-based programs operating independently, often with duplication of roles. You find out that they are doing almost the same thing, and limited coordination was existing at the time. And so CHIPS came in to fix all that. So here's what the program focuses on. This is what CHIPS as a program focuses on. Number one, harmonization and coordination. The CHIPS unites different cadres of community health volunteers under a single national framework, and this makes it easier to monitor performance, provide supervision, and ensure consistent quality of care. Improving, number two, also to improve service delivery. Number one, remember, to focus on harmonization and coordination. Number two, to focus on improving service delivery. The program strengthens the link between communities and the formal PHC system, especially for maternal, newborn, and child health. These CHIPS agents promote immunization, antenatal care, nutrition, and hygiene practices right at the household level. Number three, the program focuses on community ownership and trust. Why? Because CHIPS agents are selected from within their own communities. They have trust. They have the trust and cultural understanding needed to be able to influence behavior and encourage the people within the locality to seek care early. Number four, the program focuses on women and children. CHIPS particularly targets health outcomes for women and children, helping to reduce preventable maternal and child deaths through regular home visits, referrals, and education. And so we have quickly seen the focus of the CHIPS program. Number one, harmonization and coordination. Number two, improving service delivery. Number three, community ownership and trust. And number four, they focused on women and children. In summary, as we move to the next slide, the evolution of community health workers in Nigeria tells a story of progressive development, from the early days of the Basic Health Services Scheme and CHEW programs to this more structured and harmonized CHIPS initiative we see today. This journey shows a continuous national effort to train, to deploy, and to support community-level health workers who can truly bring healthcare closer to the people. And as ongoing initiative like CHIPS keeps maturing, they continue to address long-standing challenges, and they also strengthen Nigeria's path toward universal health coverage and better health outcomes for all. I will encourage you to check for the lecture video where I talked about the link between the PHC, the UHC, and also the SDG. That way you will really gain more knowledge as to the relationship where each of them depend on the other, and the performance at the PHC strongly will influence the SDG and achieve universal health coverage. Here you can see a CHEW sitting down and administering drugs to persons who live in the local environment. These persons, the two ladies here, probably wouldn't have been able to access health care if this PHC worker diligently didn't come to this community. But because these PHC workers are available, they are able to provide these services at this level, and lives are being preserved. We move to slide 13. Under the slide 13, I want to see the roles of primary healthcare workers. Let's talk about their roles. Let's talk about who primary healthcare workers really are and what they actually do at the community level. Now, PHC workers, sometimes called village health workers, are ordinary community members who receive special training to deliver essential health services, especially in rural and underserved areas where doctors and nurses may not always be available. So, what exactly do they do? Let's break it down. Number one, health education. One of their biggest roles is teaching people how to stay healthy. And this is critical, especially in the rural areas. They talk about things like personal hygiene, proper nutrition, maternal and child health, very key, family planning, and disease prevention. In many communities, they are the first source of health information that even a majority of the populace in the rural area will ever know, because they are always available. They stand between the community and the tertiary. They bring information, they bring treatments, they bring different opportunities and advantage to the community. As a result of what they do, they've been seen to help people make better health choices in their lives. So number one, they do a lot of health education. Number two, they also do preventive care. PHC workers are at the front line of disease prevention. They help with immunization campaigns, and they also conduct health screenings like blood pressure or malaria checks, and promote practices like exclusive breastfeeding and antenatal visits. Through their preventive work, they save countless of lives before illness even starts. Number 3, what do they do? Basic medical services. Basic medical services. They also provide first aid, treat minor illnesses, and when a case is too serious, they refer patients to the nearest health center. Some are trained to distribute basic medicines, for example, anti-malarials or oral rehydration salts, based on national health guidelines. Number 4, what do? They carry out community mobilization. Community mobilization. PHC workers don't just work in the community, they work with the community. They work within the community. They organize health talks, mobilize people for immunization days, deworming campaigns here and there, or environmental sanitation drives, so that the community, the environment is kept clean. They also encourage participation in public health programs. They often, ensure that the bridge between the health system and the people, they are always available. So the health system, they take what is needed to the people. And when there's a need to refer, they take the people to the health institutions. Why are the PHC workers so important in the light of all that I have said? Let's highlight 3 key reasons why they are very important. Number 1, accessibility. Don't forget, accessibility. They bring health services right to people's doorsteps, especially in rural or hard-to-reach areas. If you look at this picture, it makes a lot of sense, letting you know how the PHC workers and why they are so important. Number 2, equity. By reaching marginalized populations, the PHC workers help reduce health disparities and promote fairness in healthcare access. Number 3, health promotion. They support major national health goals like immunization, family planning, and disease prevention campaigns, ensuring that no one is left behind. In fact, or let me put in summary, primary health care workers are the very heartbeat of community health. They turn policies into action, connecting households with the larger health system and making health for all a real possibility. This is how we come to the end of the first aspect of this video. We have just looked at the introduction aspect, and we have dealt with a lot of sub-aspects under this topic titled Training and Support of PHC Workers. In the next video, we'll be moving into the second aspect, and there we'll be seeing the historical context and global frameworks. We'll be looking at the historical context and the global framework. I'll see you in the next video. Take time out to jot, make notes out of all that I have said. I have truly expanded on these slides a lot, and I've made mention of so many other things that you should take note of. If you enjoyed this video, please subscribe and also take time out to ask questions if you want to on the comment section. I promise to reply you every time questions are dropped there. So remember, you can like the video and you can also subscribe. Thank you. Once again, my name is Dr. Saboin Henry. I'll see you in the next video, the second part of this interesting topic on training and support of PHC workers. Thank you.